All right, guys, you will not believe what we have here. I can't believe it. She's sensational. She's so tiny, but she's a powerhouse. She won the 2022 Chicago Pro. She is no under the sensational, the beautiful, ravishing Dr. Jessica Wilson.
Thank you, Isabel. Thank you for having me.
Thank you for coming.
Wouldn't miss it.
Where did you come from? Where did you travel from?
Where? Oh, for the yes.
Yeah, where do you live?
For here, I live in Southern California.
Oh, Cali. That's not too far.
Yeah. Nope. Super easy. Up and down. That was it. We were here in a heartbeat.
Well, thank you again for coming such a long way.
Why, thank you. I wouldn't, like I said, I would have missed it for the world. I was so excited. I fangirled when you invited me.
Fangirled. I'm the one fangirling. So the wild hair here, I'm loving this because when I saw you at Chicago, it was straight. It's beautiful. I know you work with Kim Odo, right?
Yeah, that is my coach.
Who is the man. He knows what he's doing.
Yes.
You came on the Chicago Pro stage. You rocked it. Hands down, clear-cut winner as soon as you walked out prejudging. And now you're going back to the Olympia. What does that feel like for you?
I think this second time around, it has sunk in a different way. It's my second Olympia. And when I think about 2021 and how long it took me to get to that first Olympia, it took about 8 years, from the start of my career. I think that I was kind of in a phase of oohing and eyeing the entire last year. I did a lot of shows to get there, made it. It was a surreal experience. Now, it took 3 shows, I believe. I have to make sure I'm getting that right. But it took 3 shows, and it just hit different this time. And I may not be able to find the right words to describe it, but it was kind of a knowing of, this is exactly what you prepared for, and this is why you do your job every single day, and you earned it. You truly earned it. So I'm really excited about it, but again, still focused day by day. I can only move it one day at a time. And
when I saw you backstage, you're all starstruck, like you just you just have this glow to you. And I saw you this morning before hitting the gym. I mean, you look phenomenal.
Thank you.
Your conditioning is, wow, just everything. You just got that beautiful flow. So
thank you, Izzy.
Where do you see yourself at the Olympia? What are you bringing to the stage?
I am seeing myself improved from last year. Just recently, last week actually, I rewatched the clips because, of course, you study. You've got to study if you want to be competitive. And I rewatched, and at the time last year, I understood why I placed where I placed, and I was through the moon. I came in 11th last year. So almost made it to the big stage.
Sure.
And I'm really glad I didn't, because I still had a lot to improve upon. So this year, my hope is to improve, and that's what I'm preparing for, is to not only crack that top 10, crack that top 5 maybe. It's going to be a big show, but I know that as long as I do my job every single day and don't skip steps, don't cheat, don't miss the mark, then I know that I'm prepared. So whatever happens, happens. This is going to be, I think, a record-breaking Olympia with a number of competitors, bikini competitors.
What do we have now, 60?
64?
64.
60, something. 60.
And there's still more shows.
Correct. I was chatting with Kim about it, and he's like, there were 72 Bikini Pro shows this year.
72. And then you have the top 3 with points.
Right. Or 2. It's
top
2 this year.
Okay. Wow. That's a lot of people. That's a lot of cutting. I don't know how the judges do it, but they do it.
I don't know.
They do a great job at it. Well, let's go back. Let's talk about you for a second. This beautiful bombshell Dominican, which I'm not going to mess with you. You know you mean business. Dominicans, they don't play around.
Dominicana.
And you're from New York.
Correct.
Where in New York?
The Bronx.
Even worse. All right, we're not playing around. So you moved to California? Have you been there all your life? Or?
No. So I've moved around quite a bit from New York. So I was the New Yorker that was never going to leave New York because, hey, there's nothing else out there.
Right.
Now I'm the New Yorker that won't go back because there's so much else out there. But what took me onto this journey of moving around quite a bit was my veterinary career. So I ended up leaving the United States. I moved to the Caribbean for 2.5 years to the island of St. Kitts.
Beautiful place.
Beautiful place. Had a great 2.5 years there for my preclinical studies. I went to Ross University, the vet school. And then the final year, you've got to go somewhere in the United States, a veterinary school that will, you've got to apply. There's a whole process. So I chose Minnesota.
Minnesota?
I chose Minnesota because I felt like I wanted to be back close to a city. So the Twin Cities were pretty close. And I wanted to be kind of in a more metropolitan vibe. So Minnesota, and I also developed an interest in veterinary dentistry. And Minnesota had that department, very well staffed at the time. So I applied, I got in. I moved in December from the island to Minnesota in December, the worst, most intense cold I've ever felt in my life.
Right.
Spent a year there, moved back to New York, and moved to Brooklyn. And I did a 1-year internship. So the cool thing about vets is we don't have to do all this extra stuff. Once we graduate, pass our board exams, we can actually start practicing right away.
Wow.
Unlike MDs who have to do all of these extra programs for specific training. But I did my internship. I developed this interest in dentistry. I was fortunate enough to land a dentistry residency. So this is like dogs and cats I'm working on, and other animals, smaller animals, in Denver, Colorado.
That's a great place.
Great place. So I moved to Denver for a couple of years. The arrangement was a contractual obligation with the company that sponsored the residency. So I knew I was going to end up in Southern California before even moving to Denver. So I was excited about that, and I thought I have a lot of memories from childhood of things and places, things I wanted to be and do, and places I wanted to live, and that was one of the things I remember dreaming about. So I figured, this is my ticket. This is it. So now I live in Southern California, and we're good.
Right.
We're good there.
Are you still doing a dentistry? Because you're an oral surgeon.
Dentist
as well?
and oral surgeon for
Wow.
small animals. Residency trained. So part of my story and why bodybuilding is so important for me. So I never took my board exam for that specialty. Not a big deal, guys. As a vet, I can literally do anything, but these different specialties, they have their parameters, their guidelines. So I practice as a residency trained dentist. No pet parent or client ever cared. They were just excited that I could help their pets. Sure. So I ended up stumbling into bodybuilding, and maybe I'm getting ahead of myself with your questions, but it's all part of my story. Sure. Because veterinary medicine it's tough. It's tough. It's physically draining, mentally, emotionally. It can be very exhausting, particularly when you're working through a lot of very sad cases, the ones that you cannot help. Either because it's a disease that's beyond the point where you can be proactive or stop it or slow it down, or if finances are a concern. And so that became very taxing, along with the pressures of working for a private corporate practice. So I ended up burning out within my career, within my veterinary career. And it was pretty significant. It had happened once before during my residency training. And during that time in Denver, Colorado, where I did my residency training, I was going through a lot of major life changes. Sure. And I was seeing a counselor. Therapy, counseling, go for it, guys. It is so beneficial. And my counselor asked me, hey, what do you do for yourself? And I had no answer. Isabel, I had no answer. I I took care of the dog. I took care of my patients. I'd go to work. I'd come back. I'd study, and I'd went to bed. Like that was my life. And I realized that had been my life for kind of a long time. Granted, of course, I did fun things and had happy moments, but during that really challenging time period, I really understood, oh my gosh, I'm not taking care of me. How am I going to care for others? And I had developed a pretty significant health condition called neurocardiogenic syncope. And essentially, I would faint.
Oh, wow.
For no reason other than stressors. And it happened to me while I was doing surgery on a dog. And thankfully, nothing went wrong. It was the end of the procedure. I think I had done a number of surgical extractions, kind of a complex case. Everything was fine with anesthesia, but I could feel I was off. And I was kind of wrapping up the surgery, and I'm talking to my nurse, and I'm like, hey, is the dog's good? Yeah, like the dog's good. I'm closing up. I just don't feel right. So I'm looking at the clock. I'm checking my heart rate. It's really high. It's like 120, 130. Wow. I'm seated. There's nothing stressful going on. The patient is stable. I'm done with the procedure. It wasn't even very challenging. There's no reason. And so I fainted. And that was a huge wake-up call for me in falling in line with, I need to do something for me. I need to take care of myself. Because, God, what if I lost a patient?
Right.
Or what if I fainted while I was driving and I, injured myself or someone else or killed them, So, and I still get emotional about this because it was so impactful. So my counselor asked me, hey, what do you do for you? I'm like, all right, well, I guess I'm going to go to the gym. I'm going to get a gym membership. I don't know what I'm doing in there. I've done P90X, those kind of at-home workouts, but I'm a skinny little thing, and maybe putting on some muscle or gaining some strength. And in my mind, it was so that I can handle my patients more easily.
Sure.
You don't need force or strength to handle patients the right way, dogs and cats, right? So I signed up for, I think it was like a Fitness 19 in Denver. I hired and I didn't have a lot of money because I was a resident. And I hired, I budgeted whatever I could budget for a trainer, and I wanted to work with a woman because it's intimidating. As most folks know, you go to a gym for the first time, it can be intimidating. Didn't know about bodybuilding yet, by the way. But I hired this trainer. She was wonderful. Her name is Laura. I will never forget her because she changed my world. So then fast forward, I moved to California knowing, hey, I'm going to be there, and I'm running my own department. And of one, I'm the only veterinarian that's doing dentistry at the practice I was in. So that comes with a lot of stressors, right? So I knew, all right, get back in the gym. And Instagram was kind of new at the time. It was like 2011, 2012, 13, that time period. And I had a friend in Colorado that was always like, hey, get Instagram. This is like the new thing. Facebook's like over. And I'm like, I don't have time. What's a hashtag? I literally didn't have time. I'm like, what does that mean? Right.
People always ask how I got here. I was willing to work just a little harder than everyone else. Every damn day. If I can have hundreds of hours back, I'm gonna grab them. Spending hours prepping chicken, rice, and vegetables, F that. I rely on perfect nutrition. I rely on trifecta.
But then I started kind of, when I moved to California, I had some time. So I kind of started looking more into it and looking at scrolling through and watching the feed, and very, very early in Instagram. And I remember seeing some girls in glittery bikinis and clear high heels. And in my background, that's a questionable look on a social media platform. But then I started kind of digging a little bit more. And that was the time when like Paige Hathaway was competing. Sure. Jessica Arevalo was still, big in our world. And I thought, wait a minute, these are women that, they're women that are taking care of themselves, and they're displaying their hard work, and there's nothing unprofessional about this at all. So I decided, literally, Isabel, it was a moment where I'm like, I want to do this. I don't know how I'm going to do it, because I don't look like that.
Right.
But I'm going to do this someday. And I started making connections in Southern California. Fortunately, I'm blessed to be in an area in the country where bodybuilding is huge. Made some connections, found my first coach. Gosh, found my husband. Because in search for looking for a gym, I ended up at a fight gym, of all places. And I met the man that I knew. I met the man.
Well, let's talk about that first. How did that happen? Is he a fighter?
Yeah.
Oh,
So
wow.
MMA instructor. He had just gone pro, but then met me, got injured, so never actually
Who's more
competed.
violent, you or him? Being Dominican or New Yorker? And
He will hands down say it's me,
I agree.
and I agree as well. Yeah.
So what was it? You're in there, you get a membership or something? You saw him, or
Yeah.
was he your coach?
So I went in like on a Sunday. They were closing, but who's now a good friend of ours, he told me, "Hey, you know what? We're having a kickboxing class tomorrow," which was Monday, at whatever the time was. I think it was after 5 because it had to align with my work schedule. And Coach Wilson is teaching. So I'm like, all right. So I'm a girl. What do? I go on the internet and I'm like, who is this Coach Wilson?
Right.
Couldn't find anything. So I'm like, all right, well, let me just, and it was more about, let me see what this person, what qualifications. I'm getting real cerebral about it. But then I go and I walk in. I've never taken a kickboxing class in my life. And I turned my head and I saw him and I was like, oh, he's mine. He's mine. He doesn't know it yet, but he's mine. All internal thoughts. And then, introduced myself. I had, and again, I'm an open book. I had just had my breast augmentation done.
Wow.
Did it before finding bodybuilding, guys. Yeah. You don't need breast augmentation to be successful in bodybuilding. But I just happened to have just done the surgery. And so I had to tell him hey, I can't do certain moves. Sure. I will need your help in modifying. And he was cool about that. And he complimented me on my toes. And
your toes?
Yeah. Because kickboxing, you can't have shoes on the mat. And I'm like, oh, this guy. But it was a hard to get kind of situation.
Sure.
He'll paint the picture a little differently, but that's what I remember.
How cute, though.
Yeah. So bodybuilding has brought me so many good things. But back to the kind of original question about veterinarian and, how I intertwine that is it was what I needed to help me with this burnout. Absolutely. It was the outlet. And I had never, once I had realized I want to do this, let me commit to a show. I didn't know. I had never really been a performer.
Sure.
I knew I could publicly speak very well, but this isn't a speaking kind of gig, right?
No.
It's all nonverbal communication. So I really had no idea if I would even be comfortable on a stage, if I would even like the process. But in my mind, this was it. I was all in. I did my first show, and it's like the rest is history.
2014, right?
Correct. March. San Diego
What show was that?
Championship.
Was that a muscle contest?
Muscle contest, yep.
Okay.
Muscle contest. Oh, so near and dear to my heart.
Same here.
Yep.
My first national qualifier was the Excalibur.
Oh my gosh,
And I
that's a
loved
big
it.
one.
Yeah.
That's a big one. So did the first show, San Diego Championships, and I had my first coach, Eric Mara, who guided me. I wasn't super strict about the prep. I was just kind of like, okay, I won't do the cardio. I'm tired. Not taking it as seriously. Okay with the nutrition, but I got on there. I knew my posing routine like the back of my hand. And I'm so glad I practiced as much as I did because I look back at the video and I look like I know what I'm doing. I went really fast. I was not lean enough, but I had the presence. And I remember speaking to Tarek and Tamer. The foundation, the shape was there. I don't remember a single thing, Isabel. I just remember the lights were really bright. I'd never done this before. My smile went as ear to ear because I was so exhilarated. And then it was just over in a flash. And I was nationally qualified, and I didn't even know what that meant. So,
wow.
And I remember seeing Kim Odo there. I didn't know him yet, but I remember seeing him and how attentive he was with the girls and the guys, and thinking, okay, I got to look into this guy. And I just kind of put it in the back burner. But it was an incredible experience.
Do you remember what color suit you had on?
Green.
Okay.
Emerald green.
It's a great color.
Love it.
Do you feel that same feeling when you talking about it? Do you feel those emotions again?
Yeah, I'm like sweating. You guys can't see. That's why I wore black. But yeah.
How much did you practice your posing? Because you said you really practice it a lot.
I mean, every day.
Hours or just like an hour?
Not that long. Just I knew anytime I saw a mirror, anytime I had a second, I would like hit a pose just to help my body really get that understanding of what it needs to look like. Because, hey, we can practice in front of that mirror all day, but we've got to be able to make that mind-muscle connection with the posing. So I practiced a lot. I took a few posing classes. I had mentioned Jessica Arevalo earlier. She was actually my first posing coach. Oh, wow. So that like OG, I know a lot of people call it the stallion pose. I got that from her. She taught me that. So it just stuck, and my body's always been able to do that. But I took a few courses with her, did a few seminars, and then it was just doing my homework every day, making sure I'm practicing. When
you won your pro card, what was that feeling like?
Oh, my God. Well, I almost missed it.
Okay, you got to tell this story.
I'm a talker, guys.
It's all good.
And to almost my detriment, actually. So I was backstage. So actually, I'll start with prejudging, right? So Kim and I both, and I had Kim at the time.
Give us a show too.
Oh, I'm so sorry. So I went pro 2015.
A year later after your first show.
NPC USA's.
Best show.
Best show.
That's right.
Best show.
I'm also a USA overall. Yeah. There you go.
Yep. So special show. And that was my fourth show with Kim.
Wow.
So we made it pretty quickly. But I remember I know I had gotten moved. And as competitors, it's like when you're on stage, sometimes that disorientation hits and you don't really know what is going on. You're just knowing you have to follow the judge's instructions, face the back, face the front, whatever their instructions are. So I know I had been moved toward the center. And it was myself and a blonde I forget her name. She went pro and didn't actively compete, but
we see a lot of that all the time.
I know, which is heartbreaking.
Yeah.
But that's okay because it all depends on what our why and what our goal is.
Sure.
But I came in second, and it was the two of us. Right after prejudging, Sandy tells me and the other girl, "Okay, you guys can exit." And then brought the other girls in, and we all know how that goes. So the girl and I are backstage waiting just in case we get called out.
Right.
And we literally have no clue what just happened. We have it did not compute, not whatsoever. So the class is done and I was in height class B, and we go back to the hotel, and myself and another competitor on the team, we meet with Kim. We had both gotten our pro cards, and he's like, because he knows what happened. Sure. We're like, what happened? So he's a jokester. I don't know if you've talked to Kim, but he will mess.
He's very funny. Yeah,
he will mess with you. And gullible me, he's like, well, it looks like you guys came in like fourth or fifth. That's why they moved you out. And I'm just like,
I would have loved to have seen your face though the minute he said that.
Yep. It was I was still smiling, but it was the,
right.
Because 6 weeks prior, I did Chicago. I did a Junior USA's in Chicago, and I got last call out. I almost quit.
Oh, wow.
Yeah. So because that had happened, I remembered, and then I was like, nope. This is a different show, different scenario, and Kim's probably effing with you. And so then he sees us kind of like sink. And then he's like, I'm just kidding. It looks like you guys are probably in that top two.
Wow.
And so, of course, the other girl, it was Sarah Arevalo, who's married to Xavier Skaden. It was the two of us, and we're like, oh, what? Are you serious? Huh? What? Okay. But the show's not over until it's over. So then finals comes along, and I can't recall if it was a 2-day show for us or it was a 1-day show. Junior Nats was a 2-day show. But finals are there, and we're getting ready backstage. They're starting to line us up. I'm in Class B, and I'm talking to a friend of mine that's in Class C, a teammate as well. And all of a sudden, the room's like clearing because they're starting to line everybody up. And the room's clearing, and she and I are chatting, and I'm like, it's really quiet in here. And I can hear one of the expediters screaming out my number. Like, we need number, I can't remember what it was, 285 or something. Screaming out, I need 285, or whatever the number was. And I'm like, oh,
That's me.
that's me. Oh my God, I'm coming. And they're like, don't run. And I'm like, I'm running. Like,
Right.
I am not
And
missing
you're in
this.
heels.
And I'm in heels. And literally, they were lined up. And as soon as I plugged myself in, they called us out. So I almost missed it.
Yeah, you're lucky.
Because I came in second. So that would mean if I missed it, the girl that got third place was going to get
Sure,
my
of
spot,
course.
which is fair. Hey, you miss it, you miss it. So I almost missed my pro card. But that's okay. We still got it.
But then I was going to say, you still got your pro card, so it all worked out great. But let me ask you this, though. So bodybuilding saved you. 2014, you did your first show. 2015, you got your pro card. Now it's all game, right? So your first Olympia, though. Now, you got to fill me in the gaps.
Yeah.
2021 was your first Olympia?
Correct.
You recently, though, in December or November, you were in the hospital.
Mm-hmm.
You were supposed to do the Iron Games.
Correct.
What happened?
I got COVID.
Oh, COVID. Oh, jeez.
I got it big. I got it big time. I'm like, I went really extra on it. So I had been dodging it for, however long it's
Sure.
been around. And I taking, the self-care that we put into
Right.
ourselves. I know the supplementation, the way that the nutrition, the way that we treat ourselves as bodybuilders primes our health to avoid things like this. Mm-hmm. So I had done the Olympia and then took like a week or two break. Knew I was going to do SAC Pro, which I came in second to Laura Lee, which was super fun.
Sure.
And then I knew the week after I was going to do the Iron Games. And I knew I was going to call the season because, hey, that was like my 9th show last year.
Right.
So it was a lot. And so that peak week of SAC Pro in early November, that peak week was extraordinarily challenging for me. Not because of the peak week itself,
Sure.
but I had incredible amounts of work stressors. Very little sleep that week as well. And my brain just kind of forgot to take all of my supplements, like my vitamins, my quercetin, all of the things that I had been making sure I was very properly regimented on. So that week was just kind of a cluster, and I was getting maybe 4 hours of sleep each night. And up until that, and I was working all the way up until check-ins on that Friday.
Wow.
So I knew, all right, this is going to be rough. I need to get as much sleep as possible Friday into Saturday, which I did. It was great. And then I did the show Saturday. So much fun there. Came in second, and I deserved second, to be honest. When I look back at the photos and the videos, still needed to get better. So I'm like, cool, second. All right, make whatever improvements you can make in a week. Go get the Iron Games. Like, that's what you're doing. Because that show is very near and dear to my heart. It was the first show I had ever done with Kim, and it was the first show where I was announced as Jessica Wilson. In 2014, I had surprised my husband. So I'm like, I want to do the Iron Games. I want a sword. I've never won a sword. I had come in first place just, the once at Omaha Pro, but I'm like, I want Iron Games. Like, it's my hometown. Like, it's mine. Yeah, no, that didn't happen. So I flew back Sunday after SAC Pro, and I had a headache, and it was a really intense headache, and I wasn't super dehydrated. I wasn't super, depleted like some competitors can get, but it felt different. It definitely felt different. And in retrospect, I even think back when I was pumping up for finals, I felt different. I just couldn't put my finger on what it was. So I fly back Sunday. I have this headache. My husband's all excited to see me, and I'm like, I'm sorry, honey, I love you, but I get away. I need sleep. I'm not okay. I'm just like, I need to rest because I have the Iron Games to do. Then Sunday night, I have a fever. And then Monday, the fever's still there. And I'm working, hopping onto these work calls, and I'm starting to cough. And I just look awful. And even my colleagues are like, Jess, are you all right? And I'm like, oh, let me cough, Yeah, I'm fine. I'm great. So I was complete denial about it all. And the fever just remained despite me taking aspirin or ibuprofen. And then to Monday, so that's Monday. And I just felt awful. Like, I didn't even want to take my clothes off. I didn't want to shower. I just wanted to be warm, yet I was having sweats. And I told Kim, I was making Kim very aware of what's happening. And then Tuesday comes around, and the fever is higher. And I think in my brain, I hadn't registered how high the fever was, because I went into but dogs and cats, they run hotter than we do. Sure. So I'm like 99, 100.5, 101. That's not even that big a deal. But for a human, absolutely, right? So I'm just like, all right, I have a fever. It is what it is. Maybe I need some cowbell. Okay, that was really funny in my mind. Sorry.
I like the humor.
But then Wednesday, and so my husband's like, ooh, I bet that's what it is. And I'm like, nope, I'm not. It's like the thing that we must not name. So he's very realistic at this point. He's like, I'm getting some tests, and I took a test Tuesday night. It was positive, like in a second.
Oh, wow.
So then he's like, take another one. And I'm like, it's not like a pregnancy test, honey. Like it's positive. I'm symptomatic. This is real. But I took the other one. It was positive, like immediately as well. He was negative. And so Wednesday comes along, fever's still there. I'm not getting better. I cannot breathe.
Oh, wow.
So I had this moment of knowing, like, man, this sucks. Like, I'm going to the hospital. We were kind of on a goose chase to find monoclonal antibodies.
Sure.
And they were really hard to get, but there was one hospital that we could potentially get them. My husband qualified. I did not, because I was too healthy. Too healthy overall, but too sick to receive them. So we went to the hospital after I in the morning prior to going, I was still in my IFBB sweats, the tracksuit.
Yeah.
That's what I had been wearing all 3 days. And I'm like, I'm just going to wear this. This is so warm and cozy. And I remember telling my husband, this might be TMI, but I'm like, let me just change my underwear before I go with you. And I'm packing a bag. Like, give me a minute. And I remember I was on the floor I had to be on the floor to put my socks on. And I couldn't move fast. I just could not move. It was like glacial. And finally I get in the car, and we end up parking. I had to walk a little tiny ramp, and I was out of breath.
Wow.
And once the triage nurses saw us both, they tested us both. He was positive now at the time as well, but I was so sick. So they immediately, and this was heartbreaking for both of us, because they separated us immediately. He went into a tent, got his antibodies. I got put in a wheelchair and rolled in. They're like, code purple, code purple.
Oh my God.
So they put me in isolation, and I was on oxygen for 2 to 3 days.
Jeez.
And the hospital at the time was so full that I had to wait in the ER for 2 days before I got a bed. So it was a very uncomfortable experience. I knew that I would make it through. I didn't have a doubt in my mind. Like, I know I'm going to survive this, but man, this is so sucky. Like, how inconvenient.
Right. How far away was the show from then?
So that was Wednesday, and the show was Saturday.
I could see you like, okay, I feel better. I'm
going to tell you what I. I'm going to tell you what transpired just beforehand, or right when I got to the hospital. So it was actually just beforehand. So I'm like, Kim. I call Kim, and I'm like, this is happening, and I'm kind of crying about it. Yeah. Kim happened to have been he was with Sandy.
Oh.
And they make fun. Now I'm like, laugh about it, because I was delirious. And I remember telling Kim, and I think he had me on speakerphone. I'm like, Kim, don't pull me from the show yet. I have a plan. I'm going to get these antibodies on Tuesday or Wednesday, and I'm going to test negative by Friday, and I'm going to do the show. If I test negative, I will do the show. Like, delusional. It was, now it's hysterical,
right,
because I was not making any sense. And it was, I blame the fever, but part of it was just, it was not registering with me how serious this was.
What was Kim saying at that time?
What can he say?
Right, yeah.
What can he say?
And Sandy was right there with him.
Yeah, because she reached out to me much later to kind of check up on me, and she's the one who told me. She's like, girl, when you said that, you were going to try and make the show. Like, we both just kind of looked at each other and rolled our eyes like she's out of her mind. And I was like, Sandy, I was out of my mind. I had a really high fever. It did not help me think straight. So then I'm in the hospital. I'm on oxygen, never intubated, thankfully, but very delicate. I had full-blown pneumonia. All of my lung fields were affected. I mean, this is how fast it happened. I just competed Saturday, so I was also very, very lean. They were trying to find some subcutaneous fat on me to give me injections, and they're like, so by your arms, by your, your I'm like, no, you're not gonna, sorry, like there is no fat right now.
Right.
So I was like, all right, the little pouch area under the belly button, but there was nothing there. So every injection stung so much. The medications were working. But my poor veins were really sensitive to some of the medications. So my arms were painful. I had about 7 or 8 IV catheters. They actually had to even go up to my bicep vein because they couldn't, my arms were destroyed. And it took months for me to be able to, like, for everything to go back to normal. It was very painful to even move my arms. The day of the Iron Games, that Saturday, I was still there, of course. And I was just so excited to see my friends on stage. Like, I wasn't heartbroken because I wasn't in it.
Sure.
I understood at that point, like, God's telling me to sit down because I'm doing too much. But I was so just heartbroken that I just couldn't be there to support. And I'm trying to watch. They didn't have an official live stream, but I'm trying to log on to check out different accounts on IG to see if I can see something. And I was crying because I was so happy that they were up there shining and doing their thing. And I understood, it wasn't about me. It was about, my love of supporting my fellow athletes and the sport in general. But I knew it was, hey, it's my time. Like, obviously, I can't do anything about this. So I'll be here getting better because that's my one job right now is to survive this.
That's an incredible story, though.
So I got to go home. After 5 or 6 days, I got to go home. And
so 6 days total. 2 days you spent in the ER. Wow.
Yeah. So I got to go home. That, big picture is I got to go home. And I'm so thankful that I did because it could have gone a different way.
It could have definitely the way you were going.
Exactly. So it was a big second wake-up call. The fainting thing that happened in the past. Sure. And then now this. So I realized I had to kind of really take a step back and do less.
So you have such a big passion for the sport. Of course, you want to keep on going and going and going. Now, you talk about you being supportive of your peers, fellow sisters in the sport. You are very supportive of your fellow sisters. So tell me about the medical stuff because we have there's a lot of women who compete and guys who are in the medical field, especially in the veterinarian, who compete. Like I was looking at your IG and I'm like, oh my God, wow, there's just this one.
Yeah.
So you actually speak for these people. So tell me about that a little bit.
Yeah. So the veterinary career and the bodybuilding career and how I kind of blended those two together. So very early on, aside from me deciding I want to do this, like Pretty Bikinis, stage life, all of that stuff, I remember back when I started thinking, I want to show veterinarians that they can do other things and live full, rich, multifaceted lives. We are a very academic group of people that historically is awful at self-care, awful at boundaries, awful at health in general, like their own, right? And the burnout was my big, physical, emotional, mental, but the other component about veterinary medicine that a lot of folks maybe don't realize is that the depression, mental health, and suicide rates are extraordinarily high, higher than MD physician counterparts. More prevalent in the women. It's mostly a female-dominated profession, but it's like there was a time period where it's like every couple of weeks there's another or a vet tech, which is a veterinary nurse, that has committed suicide.
Why is that? Just because of the pressure?
We're, and I'm speaking in generalizations, sure. But we are we're a very giving group of people, very empathetic, very much perfectionist, type A personalities that hold the weight of the world on our shoulders. We want to save them all. And sometimes our barriers are, owners that don't want to or can't, or, finances, because it's a cash business. Sure. It's not like the human world where bill insurance and, as a patient, you don't have to put all that money up front. For us, system doesn't work that way. So we need payment up front. That's how we keep our businesses running. We also don't make the salaries that a lot of folks think we make. Definitely make way less than human physicians, like about a third to even a quarter less, depending on your area, your field, if you are a specialist. And then the insane amount of student debt that we carry as well. I carry it also. I can own a mansion and like some land in Texas or something right now, or a studio apartment in New York City for the amount of debt that I have because of the profession. So, having all those factors combined, and then the abuse that the pet owners, please be kind to your vets. They work really hard, but the abuse that pet owners will give to the vets and the staff, like, there's a switch that goes off with people. They don't see us as medical professionals sometimes. They don't see us as real doctors.
You diet down, train hard, and supplement smart for months. When the time comes to step on stage, don't leave your tan to chance. Go with the pros. Pro Tan. #1 worldwide since 1987 and the official sponsor of the Olympia for the last 15 years. Don't step on stage without it. Pro Tan.
And so what I realize, it's like, all right, what can I do to help the profession? Well, I can lead by example. That's all I can do. Right. I can help, my peers, and I've helped a few of my colleagues, my veterinary colleagues and nurses, get to better health. I did prep some people for a little bit of time, nothing that I announced publicly. I didn't have the bandwidth to really prepping someone. You have to be all in, and I couldn't be all in. So, but I helped guide several of my colleagues go through major weight loss transformations, overall health transformations. And then I realized, okay, let me then now embrace the sport in a way where I am a representative of my profession. And I want to be, and I know I'm not the first veterinarian that's an IFBB pro, because I know there is a bodybuilder from many years ago, and I haven't been able to find her. I don't remember her name, unfortunately, but I know I'm not the first veterinarian that became an IFBB pro, but at least in the 2000s or the 2010s, I was the first one. So I thought, oh my gosh, this is opportunity. Okay, I want to, and then once I went pro, what went to my mind was, okay, I want to be the first veterinarian on the Olympia stage. Sure. Because that's a big deal, and vets don't know what this all is about, but I think I can help with the exposure, right? And then I'm finding through Instagram, there are other vets that are bodybuilding too. And I'm like, wait a minute, this is a thing. Like they're taking steps, bodybuilding is very extreme. So it's not that everybody has to go be a bodybuilder, but do something for you, whatever that is. And don't be afraid to live your life outside of your medical profession, because I had a hard time kind of integrating the both in the beginning because of fear of judgment. Right. And I had colleagues, veterinarians, that called my former employer and my current employer to complain about my social media presence.
She's so much skin.
Yeah, right, exactly. It's not professional. Fortunately, nothing was ever taken seriously by those that had my corner. But, I had a little bit of fear about that, and really it was nothing. It was like 4 people total in the past 8 years from the veterinary world that have been vocal and being against what I do. So I focus on the good.
How many pets do you own?
5 currently.
Dogs?
2 dogs, 3 cats.
What are their names?
So the dogs, I have a small terrier named Peter Parker, and I have a 14-year-old. She's my island dog. I got her from St. Kitts. She's like my soul dog. Her name is Lana Lang, Miss Lana Lang. You could see a theme here.
Yeah.
And then the 3 kitties, Sir Rupert Reginald Wilson. He is a chocolate tuxedo. And he is like the most human-like creature that I have ever met in the cat world. Beerus is my soul kitty, who has come back to me. He came in another form many years ago. And then the youngest one is Sasuke.
Sasuke. Mm-hmm. You've watched, obviously, the cartoon All Dogs Go to Heaven. Mm-hmm. Made me cry.
Not in many years, but yeah, I'm a sucker for those things. So I try to not watch them because I get emotional.
There is a couple quotes I want to mention that really touched me because you're so right. I love the fact that you tell people to just live life. You know, go do it. Don't stand still kind of deal. So don't be afraid of making moves, which you're right, because you went from the veterinarian into the bodybuilding. Mm-hmm. Some people are afraid. They're afraid to cross that line. They don't, like you said, the judgment. Mm-hmm. It doesn't matter what other people think. No. I think it's all about you, what makes you happy. And then you said, I urge you all to do what you love in this lifetime.
Yeah.
I love that.
100%.
Because you're right. A lot of people aren't doing that.
Mm-hmm. This is all we've got. Mm-hmm. Like, and many people have different belief systems, of course, but like we're here now, right now. So this is what we've got, these interactions and how we can impact those around us. Humans are social creatures. We're social beings. And when you can make moves, you can affect others in a positive way. It's leading by example or being that servant leader. I serve my veterinary community. I serve my bodybuilding community. I serve, all of those that have, taken an interest to little old me. I serve them by living life to like 100% my potential. That's what I believe we are here to do. Mm-hmm. Experience everything that we want to experience. Not getting into morals and ethics, just make sure you're not hurting anybody or yourself in the process. But man, make the move.
Let's throw something out there. Let's just say you're at the Olympia and they call you as the Miss Bikini Olympia. What's going through your mind at that time?
Well, we prepared.
You're not going to faint, right?
No.
Okay.
No, it's all in. It's the gratitude and the honor of what that commitment means, because it is a big commitment. As Miss Olympia, no matter the division, or as Mr. Olympia, sure. Right? No matter the division, this is a tremendous role. And such a tremendous opportunity for impact, positive impact. Sure. And I'm just now I'm in the moment, Isabel. Mm-hmm. I'm in the moment. And it's a moment of pure gratitude because I couldn't do it alone. It's because of everybody else around me that I want to help. That's what pushes me as well. Mm-hmm. So it's not just my title. It's also your title. It's also everybody else's title out there. And I'm going to do with it. I'm going to do with it. I'm going to do the best that I possibly can by leading by example with that title, so that I can help others see they shouldn't be discouraged. Sure. If 41-year-old me can earn that title of Miss Bikini Olympia, we want to break records,
Not 41.
I've thought about
maybe
it.
22, okay, 23.
I'll take it.
You're an amazing role model.
Thank you.
Okay, you're very positive. You just have this beautiful zest for life, and the fact that you love animals, that says something about you right there. Speaking of that, you also are part owner of a dog food line. What is this?
So I'm one of the I'm not owner. Kind of joined later, but I'm a veterinarian for a company, a fresh whole food company called Just Food for Dogs. So, when we think about, well, what the heck did dogs eat before, bags of food or cans of food were made? Well, guess what? They ate what we ate, right? They're not wolves. Food. They're different. So they ate whatever we had left over, right? We all know, like, dogs are kind of scavengers. They
Right.
get into our trash. They get into, whatever is around, whether it's food or not sometimes. So it just made sense to go in this direction. And I remember learning about the company back in like 2016, 2017. I was still practicing medicine at the time. And I was in bodybuilding, of course, at that time. And I remember sitting in the room full of my fellow specialists, thinking like we were having a lunch and learn. So they were educating us on the brand. And I'm like, oh my gosh, it's formulated by veterinarians. Veterinary nutritionists are involved. They're formulating these meals the proper way for everything that a dog or cat, we have a cat line too, may need. Like, this is a no-brainer. I know what real food did for my health, staying away from processed foods. So this just makes a lot of sense. So I kind of just put it in the back burner. Didn't really know that I was going to be part of the company later, but it is a tremendous experience to do what I get to do now. I don't see patients anymore, but now I'm behind the scenes. And now what I do mostly is I educate veterinarians on what we do, because we're not taught, we're taught nutrition in veterinary medical school, but not the deep dive into formulations and other alternative feeding methods. It's not just kibble and canned food. It's like, it's real food.
Right.
Like, those two versions of feeding food, they're made for convenience, truly. And when you look back in the history of kibble and canned food, it all started around the World War I, World War II convenience factor. And the quality of the ingredients makes a difference too, because if you guys do your research on what goes into kibble or canned food, it's basically the stuff that is rejected for human consumption. Like, we can't eat that, so it goes into pet food. It gets recycled. So we do really amazing health transformations for a lot of dogs and cats. It's a ton of fun. And they're supportive of what I do with bodybuilding. When I made the move to join the company, I remember telling the founder and our chief veterinary officer at the time, I'm like, during the interview process, I'm like, so listen, I need to tell you, because if you Google me, you're going to find some imagery.
Right.
And I just want you to understand the context. And, I explained it to them. I'm like, bodybuilding is part of my life. It's my form of self-care. It's a sport that I am truly invested in, and it's not going to go away. So I just need you to be aligned with that. They thought it was amazing. They're like, wait a minute, you're a professional bodybuilder? Like, mind blown. You're disciplined. You know what food can do. I'm like, yeah, it's a pretty cool gig. Yeah. So they've been very supportive.
It's very nice.
Yeah, which is awesome. So that fear, I mean, I knocked that fear down a long time ago. What would the veterinary industry think of me? They can think what they want. Honestly, it's not going to bother me.
Sure.
But it's...
I have a confession.
Ooh.
It's kind of a gross one.
Oh.
One point I was dared to try dog food.
Oh.
Because when you look at the...
Oh.
When you look at the... Yeah. Oh. When you look at the label, it's like, oh my God, it looks amazing. So my friends dared me. And I tried a little bit of dog food. It was the most nastiest thing I ever had. It tasted
Was it canned?
It was canned.
Oh.
With gravy.
Oh.
And it had the sweet peas.
Oh.
And corn.
Oh, I'm so
I thought it was going to be
sorry.
awesome. I took that little taste.
Yeah.
It was like metal. I can't describe it.
I'm so sorry.
It's okay.
But thank you.
I lived.
You.
But anyway, that's my dog story. But listen, you're amazing. I love what you do. Keep on rocking it. I think you're going to be a big bombshell at the Olympia. You're going to surprise a lot of people. When I saw you at the Chicago, again, I love the physique that you have. Just beautiful. Every bikini person has a different physique to present, and that's amazing to me, because it's not just one look. Everybody has their own different thing. But I'm rooting for you. I'm a big fan, always will be. So if there's anything you want to say to your fans, your sponsors, your lover, your husband, put it all out there, and I'll leave it on you.
Thank you, Isabel. So to all of my sponsors, gosh, and I could start, I know I'm going to miss a few. It happened to me in Chicago Pro. I just kind of went brain dead when Bob was interviewing me there. But all of my sponsors, Global Formulas, Protam, Toxic Angels, The Shoe Fairy, Malakas, Lean Feast. I may be forgetting a few. Top America. Thank you. Thank you. Global. I think I mentioned them, but thank you for always having my back. Kim, it's been a wild ride, but you know, Papa, how I feel about our journey, and so we're all in, and we're gonna keep going until we stop. Chris, my husband, that's Mr. Wilson. Man, he's prepped with me. We've been together. I've been prepping the whole time we have been together, and I can't thank you enough for being that rock and allowing me, the little butterfly, to land. So thank you for your love and your support in dealing with this crazy Dominicana. And sorry if I made your life a little challenging, but thank you for allowing me and encouraging me to be me. And for all of the fans and everyone out there that's watching, be you. Do what you love. Don't have any fear, because before you know it, life is over. And then you never want to live with regrets. So do what you love. You will never regret it a day in your life. Thank you.
And that, folks, is the Fit Rockstar Show. Do what you love. Till next time, Fit Rockstar signing off, the beautiful Dr. Jessica Wilson, 2022 Chicago Pro winner.